Hello, everyone. This is Raj, Doctor of Physical Therapy. Thanks for joining me live today, and it will be just me today. This is the slide that most people loved this week. I think it has gotten about 200 likes, and my wife is helping me with these slides, which helps a lot, saves me a lot of time, and she does such a good job creating these posts every day. So, it's mainly how you perceive your age. So, even though you're getting older, if you start thinking you're old, you start collecting layers of that negative thinking, and that eventually turns you into believing it and feeling really depressed and not able to progress in life. So you have to push through that and think above that thought process of negative feeling, and keep finding things that you enjoy doing. You connect with people that motivate you and progress you in life. And yeah, so today's topic is I'm continuing with the presentation of how to optimize your body to prevent falls and improve your quality of life. Is it possible to build muscle at an old age? So that's the mainly topic for today. And obviously, everybody knows that it is possible to build the strength, no matter what age you are. I think there should be a slide missing right there. So no matter what age you are, you can gain muscle strength. So women and men, it doesn't matter. So you can still gain the muscle mass. What happens? Why do we need to strengthen? Like, I'm 60 plus. Why should I focus on my building my muscle? So with age, there are so many changes, as you all know. And sarcopenia is, since we are talking about muscle, I just put those 2 points there. Sarcopenia, which is muscle mass loss, and decreased muscle fiber quality. So when you're younger, you lose muscle at a much slower rate than when you're older. That's the aging process. So you build muscle faster, you lose muscle slower when you're younger. When you get old, you build muscle slower, lose muscle faster. I think if I remember correctly, it's I think 2% a week, something. So you have to continuously building the strength. It can be body weight training, it can be therapy bands, it can be dumbbells, it can be equipment, gym equipment, doesn't matter. But on a regular basis, you have to work on strength training. Every other day is recommended. Even if you skip one or 2 days, that's fine. Just resume your regular strength training routine as soon as possible. So, benefits of the muscle strength training in the golden age. So that's mainly, if most of our body, you know, when you look at a person, what you see is muscle. It's all major part of the body. The musculoskeletal system is what we see when you see a person. You don't see internal organs or anything, just the muscle. So the muscle is very important to maintain your mobility, your balance. Your daily functions depend on your strength and your overall quality of life. So if you're not maintaining muscle, you are obviously, day by day, you're decreasing your activity. You're not feeling comfortable going to see a friend or going to an event in the community. So you're always thinking to stay home. That's why should, you know, whenever you get a chance, you should think about getting out of the house and go outside to do an activity. Even if it is a simple activity, you should focus on leaving home. It's based on your age and your limitations, but if the weather is bad, you can go out anyway. If you have sickness, you can go out anyway. So when you are doing well, I think you should not stay home, watching TV or sitting around. That's my perspective. That's what I try to do, and I encourage my patients to do the same. So taking the proactive steps will really help you maintain your activity. Basically, seeing a physical therapist will you can discuss about the different ways. I should have said just find a fitness coach or fitness trainer, but I would suggest seeing a physical therapist first, because physical therapist can find out what the deficits are, what your focus should be. So that's the reason, if you haven't seen a physical therapist recently, I would highly recommend see a physical therapist. Get your major muscle testing done. You will know what the deficits are. If you have tightness, they'll be able to help you. If you have weakness in particular muscle groups, they can help you. Once that is done, you can go to a fitness trainer. That's not a problem. But if you have problems and go to a fitness trainer, they're not educated in anatomy as much as physical therapist is, and you end up quitting the exercise program altogether. So I highly recommend seeing a physical therapist before going to a fitness trainer. I think that's all for today. So I that's the time I got to make this presentation. So I will continue to work on this, add more slides, or in the next in the next session I will talk about how nutrition will help you increasing protein and all that stuff. So hope that helps, and thanks for joining me today again. You guys take care. Thank you. Bye bye.